First aid bleeding. Most bleeding is from minor external wounds, such as lacerations, skin tears or abrasions, and requires nothing more than a dressing. More serious blood loss can occur from deep wounds or from hidden internal injuries. Massive or ongoing bleeding may lead to shock, loss of consciousness, or death if not controlled. For mild to moderate bleeding, ask the patient to lie down. This helps prevent an unexpected faint. Wear gloves and remove small or unembedded objects from the wound. Leave large or deeply embedded objects in place and place padding around them, as removal can cause unmanageable bleeding. Use the patient's clothing, a towel or a dressing to avoid cutting yourself. Apply firm, direct pressure with your fingers or hand on the bleeding wound. Dress and bandage the wound once the bleeding has stopped. If you can elevate the extremity while continuing to apply firm, direct pressure, then do so. If there is significant bleeding through a bandage, remove all the dressings and reapply firm, direct and prolonged pressure directly onto the wound until the bleeding has stopped. Then reapply a dressing. Never apply a tighter dressing or more dressings to stop bleeding. Use firm, direct finger or hand pressure to stop bleeding. For bleeding from a nosebleed, have the patient lean forward and pinch the entire soft part of the nose firmly shut for 20 minutes. For simple abrasions, scrapes or lacerations, cuts, have the patient place their wound under a running, cool tap for 5 minutes to help reduce the risk of infection. Dry and apply a simple dressing. Patients with open skin wounds, such as lacerations and puncture wounds, should be referred to their GP for a wound check and to check their need for a tetanus booster immunization within 2 days.